Hi there, I'm Dr. Paul, the Confident Smile Creator from Absolute Dental Care. Quite often when we have a tooth that dies from either decay or there's trauma or something like that, we can actually save the tooth with a process called root fillings or root canal therapy, or you might have heard the term RCT. A lot of people get a fear about what they are and say, oh, it's a great amount of pain and so on and so forth. But it actually is not the root filling that hurts. It's the initial toothache that quite often hurts. When people get an abscess. And an abscess is when the nerve dies and you get a big infection around the end. It's a bit like a big pimple around the end of your tooth. If you remember that when you're a teenager or whatnot, you get the pimple that grows on your face, oh, the skin hurts. Well, same sort of thing can happen underneath our tooth. But what happens is a collection of pus, and yes, that's the technical term, collection of pus around the outside, underneath the tooth, and it can't go anywhere because the bone and the pressure increases, and that's why you feel the pain. Also inside the tooth, when it becomes very inflamed, same thing, it swells and the nerves just don't like it. So what is a root filling? Let's draw a tooth first. If this is our tooth, and the roots around the end of that tooth, around the outside is the enamel around the outside of the tooth, and in the middle of the tooth here, there's a nerve that's on the inside. And that nerve has a nerve, some blood vessels and a number of other things and some connective tissue in there. When the decay gets through into that nerve and causes that nerve to die, we get this abscess forming around the end of the tooth. And once again, that's what hurts. A root filling is designed to go down inside the tooth, remove all that dead and dying nerve out of the inside of the tooth, and then replace it with a rubber filling inside the tooth so the bacteria doesn't get back in. And what the root canal process is all about is, if you can imagine the canals shaped like this all the way down, and really fine canals, and they can be as small as 0.15 of a millimetre, which is obviously quite tiny. And we have to get in there and take all that dead and dying nerve out, and take the debris off the canal walls that are in there to make it nice and clean, sterilise it, and we use the addition of a laser in our practice as well to further sterilise things. We flush it all out, and then we put that rubber filling down in its place to seal it back off. And then we actually put a normal filling in the top of the tooth, and then at a later stage you'll need a cap or a crown around most of those teeth as well. And that seals off the tooth, allows the body to heal the infection around the end there, and that way hopefully you'll keep that tooth. And on average you keep a tooth for about 7 to 10 years after they're root filled, provided they're crowned. Once again, that's about root fillings in a nutshell. If we can help you out with one, or if you have any other concerns, please give us a call on 3870 1300. Once again, I'm Dr. Paul, the Confident Smile Creator from Absolute Dental Care here on Model Road at Taringa. Look forward to talking to you soon. Take care. Bye.